Hello again, and welcome to PodcastDX, the show that brings you interviews with people just like you whose lives were forever changed by a medical diagnosis.
I'm Lita.
I'm Ron.
And I'm Jean Marie.
Collectively, we're the hosts of PodcastDX.
On today's show, we're talking about a substance you might know from the dentist's office, or unfortunately, from some less safe place. That's right, we're diving into the dangers of nitrous oxide. You may know it as laughing gas, party gas, or even hippie crack. Thanks, BBC. I wouldn't have known that otherwise.
And it sounds harmless when you call it laughing gas, but the reality is far from funny. Misuse of nitrous oxide, or it's actually dinitrous monoxide, can cause serious and sometimes permanent health issues. And sadly, cases of problematic health concerns or health-related conditions are on the rise.
Nitrous oxide was first discovered in 1772 by chemist Joseph Priestley, who also discovered oxygen. He was a busy guy.
It's that way.
It was initially used for recreational purposes in the early 1800s. Basically, people would gather at parties to inhale it and laugh hysterically. So it was like an 1800 version of Tic Tac trends, but with the top hats and corsets.
Later, doctors realized its potential as a mild anesthetic, and dentists started using it around 1844, and it's still being used today in medical settings, but under very controlled conditions. This is not something that you should be huffing from a balloon at a concert.
According to the American College of Emergency Physicians, nitrous oxide misuse has been steadily rising, especially among young adults and teenagers. Emergency room visits related to nitrous oxide have doubled in the past decade.
And in places like the UK, where it's the second most commonly used recreational drug among 16 to 24-year-olds, doctors have reported a spike in serious cases, including paralysis. Not exactly the giggles they were hoping for.
Right. Short-term nitrous oxide can cause lightheadedness. It can cause euphoria, dizziness, numbness, and distorted sound perception. That all may sound fun until it's not.
Yeah, when used improperly or in great quantities or over an extended period of time, you can develop headaches, confusion, weakness, tingling in your arms and legs, and even hallucinations.
And if you hear someone say they feel buzzed after inhaling nitrous oxide, that's not just a figure of speech. Your brain isn't getting enough oxygen. That's called hypoxia, and it is extremely dangerous.
Doctors usually diagnose nitrous oxide misuse based on symptoms and the patient history. Blood tests can show vitamin B12 deficiency, and MRIs can reveal damage to the spinal cord if things have progressed to that extent.
But if someone is misusing it, they might not want to admit that.
Right.
And denial isn't just a river, in Egypt. It's a pretty common theme for substance misuse cases.
Right? Yeah.
Long-term or heavy use of nitrous oxide can lead to some severe problems. It can cause a vitamin B12 deficiency, resulting in nerve damage.
Right.
Wow.
And we're talking about like numbness, trouble walking, muscle weakness, memory loss, and even paralysis. And in severe cases, that nerve damage is permanent.
That's terrifying.
It is.
It can also cause issues with your heart. It can result in arrhythmias. It can increase your risk of having a stroke. And inhaling from a pressurized tank directly, that can freeze your lungs, your lips, your mouth. It can actually,
Cause frostbite of your
frostbite.
lungs.
Yeah, that's not a cool party trick. That's extremely dangerous.
Well, the first step in treatment is stopping use, obviously. After that, treatment often includes vitamin B12 supplementation, physical therapy for nerve damage, and counseling to address any substance misuse patterns.
And in cases where there's been serious spinal cord involvement, recovery can take months. Early intervention makes a big difference.
In other words, the sooner someone gets help, the better. And if you suspect someone is using nitrous oxide recreationally, so to speak, make sure you speak up. It could save their life, or at least save them from a lifetime of neurological problems.
Education is a huge part of prevention. Many young people think of nitrous oxide as harmless because it's legal in certain forms, like whipped cream, canisters, or catering supplies.
But just because you can legally buy something doesn't mean it's safe to misuse. You can buy a hammer, but you wouldn't want to use it to clean your teeth.
Prevention also means keeping products like, for example, there's a brand name nitrous oxide, and you might have heard about this in like Rolling Stone magazine. They did an article on it and the lawsuits surrounding it. It's called Galaxy Gas or whipped cream chargers. Keeping those out of reach from kids and teens and talking openly about the risks.
Some countries are starting to crack down, like the UK, for example.
Mm-hmm.
They announced plans to ban recreational possession of nitrous oxide in 2023. Other countries are looking into similar measures.
Meanwhile, here,
Mhm.
public health campaigns, they're trying to raise awareness, and medical professionals are now pushing for more education about just how dangerous this seemingly quote-unquote fun gas.
And the dangers aren't just theoretical. In 2021, a British medical journal published case studies of patients as young as 19 who developed spinal cord damage after regular nitrous oxide use. And one patient had to relearn how to walk.
Well, here in the U.S., there's growing concern about whippets. Those are small canisters used in whipped cream displays. They're legal and they're easy to find online. And then some of the social media platforms have shown people using them at parties, which unfortunately just normalizes their behavior.
Right. I mean, you're a parent of recent teenagers. Have you ever heard of people going to a concert and buying a balloon full of nitrous oxide? I mean, people take the canister, tap it off into balloons, and sell them.
And the problem is it has like an anesthesia effect. So it's going to affect your short-term memory as well. So there can be issues in terms of
if you're in the
assault.
dental chair,
No, I know, right. So
you can't drive.
right. No, not only not drive, but like there's an increased risk of assault.
Oh,
With
right,
it.
because you're semi-conscious.
Right.
Well, the problem is, and again, we talked about it at the beginning, you find something that's good or has positive qualities, and people find a way to misuse that.
Right.
True.
Right.
Yep. Well, yeah, like we're not trying to give you all this information so that you can use it improperly. We're trying to
Awareness.
educate you
Right.
so
It's
that
awareness.
you could
Yeah.
be aware of your surroundings, and if you see
Right.
this going on, and you could ask your kids, are you
And then also just realize that it's more dangerous than you might have
right?
originally
Just
thought.
because it's legal
Right.
doesn't mean it's safe.
And it's just like you wouldn't accept a drink from a stranger.
Right.
And you watch your drinks. You should not be using this because, like I said, it could open you up.
Unregulated.
It opens you up to a lot of issues.
There are even nitrous oxide delivery services popping up
What?
in some cities, like food delivery. But instead of burritos, people are getting balloons full of gas.
Get out of here.
That's deeply concerning, especially when targeting college campuses.
In addition to medical risks, there's also a link between nitrous oxide misuse and injury from accidents. Impaired motor skills and poor judgment under the influence can lead to falls, car crashes, or even drownings.
Police and EMTs have also reported responding to overdose calls where canisters litter the scene. It's not just a problem in nightclubs. People are using them in parking lots, bedrooms, even when they're driving behind the wheel.
It's terrifying.
It is
Mhm.
terrible. And there's no law against it, huh?
There's no law against buying or selling it right now.
But there is a law against driving while
You
okay.
can't be driving when you're using it.
Okay.
That would be illegal. It would be driving under the
under
influence.
influence
Yeah.
of something. Okay.
Yeah.
The environmental impact is worth noting too. Discarded canisters are often found in parks and neighborhoods. They're non-biodegradable and they add to the litter pollution.
And they're huge. I mean, you were talking about like whippets are little. These are like the size of a scuba tank. They're
Not that big. Actually, I was looking at it.
Yeah.
Not not as big as a personal, the ones that you take when you're snorkeling,
Mhm.
and then you switch over to that little
I mean,
one.
they're big. They're,
Not
it's
that
not.
big.
It's not. So I mean, it's.
I mean,
They're not something you can fit into your pocket.
Oh,
Yeah.
no. You
No.
need no.
Yeah.
They're big.
but they're not as big as scuba tanks.
Oh.
Scuba tanks are really, really big.
Okay, like a small scuba, a personal.
Yeah, a
scuba.
personal scuba
Yeah,
tank
okay.
if you're snorkeling.
And they're not
Wow.
like a 2-liter bottle. They're huge. They're bigger than a 2-liter bottle. Okay.
I don't know where we were.
We
The environmental
were
impact.
talking
So now
about.
it's
So it's me.
green.
Advocates are calling for stronger regulations, not to punish the users, but to ensure the safe labeling, age restrictions, and packaging that makes it harder to misuse. And if they're claiming that this is for culinary uses, which is the case most of the time, then it should be, purchase. You should have to have a business license and have a culinary business.
Mm-hmm.
So parents, educators, and healthcare providers also play a role.
Sure.
Start the conversations early. Most young people don't even know the risks. Why we're doing what we're doing right now.
Yeah.
As I said earlier, they associate nitrous oxide with dentists and birthday cake. Certainly not some of the neurological damage that can occur from it.
Right. Some schools and prevention programs are including whippets in their drug education talks alongside vaping, alcohol, and opioids. That's a good move because nitrous oxide is a real threat, even if it's not yet a
Mhm.
headline drug.
And let's face it, the name laughing gas makes it sound, like fun or silly or trivial. And we need to change that perception with facts, stories, and support. Nobody laughs when they lose their ability to walk, or even, there have been cases of death after usage. And just we're just trying to spread the word and make sure that you stay safe and healthy. And keep in mind that this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition or treatment and before undertaking a new healthcare regime. Never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast.
Thank you for listening to this episode of Podcast DX. Stay healthy and maybe stick to whipped cream on your pie and not in a balloon. Seriously? Who wrote this?
Till next week.